Hi, I'm Andrew Grecki, physical therapist at Superior Physical Therapy, and we are the knee pain specialists. I'm here today to help you understand where your knee pain is coming from. You're probably wondering, is it my meniscus? Did I tear my ACL? Why is my knee swelling? Why does it hurt when I walk or run? So today we're going to try to help you shed some light on where your knee pain is coming from, and we're going to teach you a 30-second self-test for knee pain so that you can help understand. Before I show you the 30-second self-test for knee pain, I just wanted to go over some of the common causes of knee pain. One of the common causes we see here is animation that shows a meniscus tear. A meniscus is this cartilage ring that is along the outer surface of the joint of the knee, and during some activities that outer ring, that cartilage material can tear, which can cause locking, popping, and pain in the knee. This image here shows MCL injuries, which stands for medial collateral ligament. That is in the inside of the knee, so sometimes we can have inside knee pain. And this shows that there are 3 grades of tearing or spraining, and a grade 3 is a complete tear, which would require surgery, and the grade 1 and grade 2 would be recovered through physical therapy. Here shows osteoarthritis of the knee joint. Left side shows a nice healthy cartilage of the knee, and the right side you can see how the cartilage is worn down and there's osteophytes or bone spurs that are actually in the knee. This is a condition called Osgood-Schlatters. This is a side view of the knee. It shows the patellar tendon that comes down from the quadriceps, attaches to the tibia, and actually starts to pull off of the bone. Very common condition in young kids. And finally, the most common thing we see is patellofemoral pain. You can see the patella is a floating bone, it's the kneecap, and anytime that joint is getting out of alignment because of muscle imbalances in the hips or the feet, as that kneecap slides up and down when our knee bends, that area becomes inflamed, and we call that patellofemoral joint dysfunction. So I'm here to show you the 30-second self-test for knee pain. But before I do that, some of the common things that I hear from people that are bothering their knees would be things like walking, running, going up and down stairs, gardening, kneeling down, squatting down. Those are all things that our knees have to be able to do, and without those abilities, our lives can be affected. So if that's you, this will be a very good test to determine whether or not your knee is functioning properly, and then allows you to hopefully understand that you could come to physical therapy and we can help you with your knee pain. Let me just show you a test that will give you information on, number one, what the knee should be able to do. And if any of these movements hurt your knee, then we know that we can restore those movements by going to physical therapy. So the first thing we know is that my knee should be able to handle a step forward on each side. So if I step forward and my knee is having pain, that's a big signal that says, wow, that's a good enough test for me. That says my knee should be able to do that. The second thing we know my knee should be able to do is step side to side. So side to side, as my knee bends, that's a different motion and position. I should be able to do that. The third thing we should be able to do is rotate our knee. So that looks like this. I rotate back, I rotate back. I also should be able to step backwards, step behind and bend my knee. I should be able to take my knee across my body and bend it. Across my body and bend it. And finally, I should be able to take my knee and rotate it across my body and rotate it across my body here. If any one of those 6 movements causes pain, that's an easy test to say, gosh, I should be able to do that. Therefore, the test says my knee is hurting. Now, the next step is to look at those motions and recognize that each time I'm stepping in those 6 directions, my foot, my knee, and my hip are all doing something different. And seeing a physical therapist at Superior Physical Therapy allows us to look at those 6 motions, and you tell us which ones hurt, and then we can tell you which muscles, joints might be the problem, and therefore give you some restorative exercises to decrease the stress on your knee. Well, now that you've performed the 30-second self-test for knee pain, hopefully you have more information, and hopefully you'll take that next step. We know taking that next step is very difficult, but if you're ready to take that next step, please give us a call. Like I said, At Superior Physical Therapy, we have knee pain specialists who are trained to deal with the exact problem that you have. Our number is 944-6541, and we guarantee that we will be able to give you an assessment within 24 hours. We also understand that you might not be able to come in or you might not want to yet. So we've also created a resource on our website called the Top 3 Knee Pain Exercises that are a good start for you to try to handle this on your own. They address the most common reasons for knee pain, but there are many causes of knee pain, and that's why it's important to get a professional physical therapist who specializes in knee pain to take a look at your entire body so they can determine the source of your pain and give you permanent solutions. We hope you enjoyed our 30-second self-test.